Good evening, everybody. Thank you for joining us. I am Sean Hockiel. I'm the manager of Donor Giving, Communications and Stewardship. Thank you so much for attending this evening. I will briefly go over our agenda for this evening and then turn it over to our first speaker. We have enabled the chat feature for participants to submit questions that will be addressed towards the end of our program. We've committed to a 1-hour event tonight, and we will try hard to keep it within that time frame. We ask for your patience as we navigate this new technology that we're using tonight. The following people are here with us this evening. We have Michelle Casey, we have Christian Olick, Dr. Amy Potter, Chris Spicer, Deborah McDowell Hernandez, and a friend of Planned Parenthood, Stuart Mitchell. I would first like to introduce our special guest this evening that will lead us in a moment of silence. Stuart Mitchell, founder and president of the Pathstone Foundation.
Good afternoon, everyone. A moment of reflection. We offer a moment of silence to remember those in our Black and Brown communities that have dealt with racial violence for centuries, and for the lives of those lost as a result of this oppression and the lack of equal justice. We at Planned Parenthood are committed to advancing racial equality, diversity, and inclusion, and are outraged at the recent acts of violence against persons of color, such as Ahmaud Arbery, Breonna Taylor, George Floyd, and so many others. They are stark reminders of the racial inequality that exists daily in and around all of us. Let us, in this moment, reflect on where we are at as champions for justice through Planned Parenthood. Let us reflect.
Whoa.
I would welcome you to this meeting with the compelling wisdom of Cesar Chavez. We can choose to use our lives for others to bring about a better and more just world for our children. People who make that choice will know hardship and sacrifice. But if you give yourself totally to the nonviolent struggle for peace and justice, you also find that people give you their hearts, and you will never go hungry and never be alone. And in giving of yourself, you will discover a whole new life full of meaning and love. May it be so.
Thank you, Stuart. Next, I would like to introduce the President and CEO of Planned Parenthood, Michelle Casey.
Thank you, Sean, and thank you all for being here tonight. It's good to know that so many of our friends and supporters are here with us. I really wish we were able to be together in person, but I'm really grateful that you are spending your time with us this evening, and I'm grateful for the technology to be able to connect with folks. I don't know what we would have done in the 1970s with this kind of situation. So the initial remarks that I prepared to share with you are really focused on our response to COVID-19. And as our nation confronts this pandemic and COVID-19 continues to disproportionately ravage the health and economic stability of the Black community, we really must address the public health crisis that racism presents. The protests of this past week, set up against the backdrop of the ongoing pandemic, have been really I see as a cry for help and asking for a commitment to human decency and equal justice under the law. That is not a lot to ask. But it's something that we have not been able to deliver on as a society. Public health, by definition, is really built on the principle of saving lives and preserving the common good. This includes looking at the whole person, including things like having meaningful access to healthcare, good jobs, adequate education, and safe housing. There has been no greater threat to Black lives than violence and oppression inflicted at the hands of the state through the use of excessive police force and centuries of systemic racism and implicit bias that impacts every aspect of their lives. I want to begin tonight by taking a moment to address the senseless deaths of George Floyd, Breonna Taylor, Ahmaud Arbery, Tony McDade, David McAtee, and many, many, many others that came before them. I can't begin to imagine what our Black patients, staff, and supporters are experiencing and feeling right now. For far too long, we as a country have underinvested and under-resourced Black and Latinx communities, leading to less access to healthcare and dramatic health disparities. Even with the Affordable Care Act, which initially helped with uninsured rates, we've seen with recent policies, those uninsured rates begin to tick back up. Maternal mortality is 3 times higher for Black women than for white women. The death rate due to breast cancer is 40% higher, and Black women have twice as many unintended pregnancies and are 4 times as likely to contract HIV. This is about systemic issues and isn't about personal responsibility. Planned Parenthood's mission really today is to build a world in which every person, regardless of their race, income, and insurance, gender identity, sexual orientation, abilities, or immigration status, can really access expert, compassionate, sexual and reproductive health care, information, and education without shame or judgment. At PPCWNY, we've been working relentlessly throughout this pandemic to maintain and expand access to essential healthcare services to all who come through our doors. We tend to serve folks who have less access to services and things like that, and so we feel that access is a key pillar of our mission and why we exist. All of our bricks and mortar health centers have remained open up until this point for at least 1 day a week, so we can ensure access in each of the communities we serve and not have transportation issues further complicate people's access to care. As you imagine, this has been really a scary time for both our patients and staff, and I have never really been prouder of our compassionate and dedicated employees. They have really risen to the occasion. We've been receiving really great feedback from our patients during this time about the help we've offered. I wanted to share a comment a patient really recently left for us from our Main Street location in Buffalo. The person said, "I needed to be checked for a possible STI right in the middle of COVID-19. I'm disabled too, so I'm high risk. I called Planned Parenthood and they set up an appointment for the next day. When I got there, I felt very safe. They were taking every possible precaution to prevent the spread of the virus. Everyone was courteous and kind, and it was a very positive experience." I know that sounds like another sort of day in the park, but you know, to people who come across our doors, this is not another day in the park for them. And really we do these things every day, but for the people that we see, it's a one-time, it's often a situation that they're worried about or concerned about, and that we can be there for them is something I'm extremely proud of. In addition to continuing to see our patients in our health centers as their needs require, we've also added site-to-home telehealth services. In the past, we've had the ability to connect a patient in one of our health centers to one of the doctors and nurses in a different PPCWNY facility, but this was quite a different situation. I'm really proud to share that we're now able to see patients in their own homes through their phones and smart devices. Dr. Potter's really going to be going into more details on this a little later, so I'm not going to dive in there. Our staff has also creatively collaborated to move all possible access or aspects of our programming to the virtual space. This includes our youth programming, our domestic violence and sexual assault services. Our education and public affairs teams have also held several successful events and are engaging supporters and activists in new ways. And, you know, what we're doing here today is an example of that. Through the tireless work of staff, changes that would have taken months and years to implement under normal circumstances were implemented in a matter of days and weeks. I cannot tell you how fast things have moved and how much things have transformed in just a very short period of time. We have been really laser focused on helping support our employees during this time. We feel if we're taking care of the employees will take care of the people that we serve. We have implemented every measure, both required and suggested by the New York State Department of Health and the Centers for Disease Control and Prevention, to keep our staff and the people we serve safe. We feel it's important to be evidence-based in our actions, and we're committed to continuing that. All of our staff whose work did not require them to be in the office have been working from home, although we are slowly and thoughtfully returning to the office incrementally as we can and as is necessary. We don't really want to bring people back into the office just to have them there. We also implemented what we call hero pay, or a pay differential for our frontline health center staff who directly treat our patients. There was a lot of worry in the beginning here around how that might impact healthcare workers, and we really wanted to recognize that for them. So far, we've only had to place a small number of individuals on furlough. As I'm sure you can imagine, it's been an incredibly challenging time for us to strategically budget for the future as we look at a likely second wave of infections. We are looking at this crisis in a 2-year time frame. In terms of operations and finances, that's likely the arc of the issue. Because of many of the changes we have implemented, we're facing a higher operating cost while bringing in less revenue from our health center operations. And as you might imagine, that's not a great equation, right? And as the state grapples with its budget deficit, we may see significant cuts to grant funding. And we've already had a 1.5% cut in our non-family planning Medicaid reimbursed services. You may have seen also in the news that almost 40 Planned Parenthood affiliates received forgivable loans through the Small Business Administration's Paycheck Protection Program, which is through the CARES Act. PPCWNY is one of the affiliates who applied for, and we received a $2.6 million loan that was based on the size of our payroll. This was really a godsend for us to have, given that we're a safety net health provider and helping our communities in such critical ways. There's quite a bit of misinformation that's being widely reported, especially in conservative media, that I understand might create a real sense of concern for our supporters. So I really wanted to briefly address this with you and go over some of the facts surrounding this situation. The Paycheck Protection Program provided forgivable loans to small businesses and not-for-profits in the wake of the economic threats by COVID-19. The purpose of these loans really was to enable small companies with less than 500 employees to be able to keep employees working instead of reverting to layoffs or furloughs as the pandemic was impacting all aspects of our lives. Obviously, here, all the work we were doing to transform care and to continue providing services, it was great to have these dollars, and having less revenue coming in, it was great to have these dollars help us out. We really acted in good faith in applying for this money, and on the advice of our bank and legal counsel, who agreed that we were eligible for this loan. It helped us, allowed us to continue providing the essential services that we provide, and largely really maintain our staffing level versus having them to go on furlough and receiving unemployment benefits and the expanded federal unemployment benefits. We recently have been contacted by the Small Business Administration, who's claimed that our affiliate applied for this forgivable loan under false circumstances. They're saying we knew we were ineligible based on PPFA's affiliate structure, which is just not true. There's no basis in reality there. We're actually a membership organization made up of separately incorporated member organizations, much like the Boys and Girls Clubs of America, the YMCA, the YWCA, United Way, etc. At PPCWNY, we have our own board of directors, our own CEO, our own articles of incorporation. The Planned Parenthood Federation of America cannot tell us what to do, so and doesn't control our company, and that's what the Small Business Administration is saying. The SBA has refused to back our loan, which has not happened to most of the other Planned Parenthood organizations, and our bank has since requested that we return the funds we received. As you might imagine, having to give back $2.6 million, especially at this time of crisis, has been an extremely difficult situation. I see this attack as baseless and political, and we're in the beginning stages of fighting these allegations, but it will have significant financial implications for us and is likely to take a very long time to resolve, which isn't helpful as we're going through our process to try to be sustainable and be here for the communities we're in. To our knowledge, we've really been singled out to trying to take back these forgivable loans, and other similar organizations haven't really been treated in this way. As an organization, I can tell you as the CEO that we would have proceeded differently if we had known we would not receive the forgivable loan. We would have made much different decisions 7 weeks ago about what we were doing than what we actually did. We're 7 weeks through an 8-week program, and that's a really difficult time to learn that you don't have these dollars. We're currently doing further contingency planning to deal with the imbalance between the funds coming in and the funds going out. As you know, we're often the only source of health care for many of our patients, and the unfortunate reality is that the pandemic has increased existing barriers to care for many of the communities that we serve. We remain focused on providing critical services no matter what. We continue to position ourselves to meet our vision of growing access to the services to meet the needs of our region as we get through this pandemic. We feel there are unmet access needs and that we need to get in that space to do that. You are really one of the major reasons we're able to continue this work, and I want to thank you from the bottom of my heart for your support. Without you, our mission really would not be possible. In closing, I'd like to leave you with one comment from a patient at our University Avenue clinic. It was my first time. I was so scared and unsure of what to do. The staff is wonderful, very kind, reassuring, and professional. The nurses are extremely understanding and non-judgmental. I can't thank them enough for being patient and kind through this time. Thank you very much, and I look forward to our discussion.
Thanks, Michelle. Now I invite President and CFO Christian Olek to give us an update on our financial health.
Thanks, Sean. Just want to welcome everyone tonight. As Michelle said, missing seeing many of you in person. Normally I'm walking around the room showing a glass of wine and some discussion with many of you. So, and after you heard what Michelle had to say, a glass of wine sounds really good right now. So, just wanted to be able to share with you. Normally, what I would share tonight wouldn't be something we'd share broadly, but, as close friends of ours and donors and supporters, I think it's really important you understand what we're contending with some of the details and kind of how we're navigating some of those decisions. One of the first things we did as kind of COVID-19 was breaking in mid-March was to start putting together like internal models to give us a sense for with the data that we had at the time, meeting with other affiliates across the country to get a sense for what could happen. Our initial models had us down in health center revenue 50% April through June, another 25% drop, or actually recovery, so only a 25% drop from July through September, and then only a 10% drop in October, and then we kind of changed the model in the last month and a half for November and December and put it back to a 25% health center drop, expecting, as Michelle talked about, kind of a resurgence potentially in the fall. Based on that model, we've been kind of tracking in real time what's been going on. Normally we track visits and revenue on a monthly basis. We've literally been looking at them every day. And I can, kind of report on a few of those things. Some of our visit data, we started in March. So again, March was only halfway through. We ended the month 14% down in visits. By April, we were almost 43% down in visits. And in May, we started recovering a little bit, and we're down 31% in visits. To give you a sense how that translates in health center revenue, in March we were about 13% down in health center revenue, climbed to 21% in April, and although May's not completely closed, it looks like we're projected to be about 27% down in health center revenue. I think the important thing to note is kind of a silver lining or interesting piece there is that these are net drops in total visits and total health center revenue. What we've actually been seeing is the drops, about a 26% drop in our non-abortion service revenue, but a 56% increase in abortion service revenue and visits. So because of much of the work and some of the donations we got last year to be able to expand those services and access, that's really been, even though we've been in the midst of COVID, and I know Amy's going to talk about this further, but they've done the health services team has done an amazing job to really see our patients and see those increases on the abortion services side. Additionally, investments. I'm sure many of you have looked at your investment accounts. We started the year at 7.4 million. The low point for us has been about 5.7 million so far. And as of about a day or so ago, our investments are sitting at 6.6 million. Why that's important is they really are pegged to our ability to borrow. So when we got down to 5.7 million, our ability to borrow and be able to sustain ourselves through normal cash flow situations and operations gets very difficult. And so the market returning in the short term right now has been helpful, but obviously something we're constantly keeping an eye on. And then finally, we're, something we haven't put in our model, but Michelle mentioned briefly, is just we're waiting on what other cuts might be coming. For those of you who've been watching the news, New York State is facing a massive budget shortfall. And so we are also waiting to see what effect that might have on some of our numerous grant funded programs and how that could affect our financial sustainability and what other decisions we'd have to make on that front. So some of the current that's some of the current realities. I think what have we been doing to mitigate some of that? Telehealth, which I know Dr. Potter is going to talk about in a little bit. That's really been why those numbers have been recovering and outperforming the model. Again, we'd expected about 50% drops, and by the end of May, we're only at 30%. So a big story to tell there is, I think, a couple things. Telehealth, massive rule changes, not only from PPFA, but payers, that were allowing us to do things we've always wanted to do, but we were forced to kind of do site-to-site telehealth. We're now able to see patients while they're sitting in their home or wherever they may be. And that's been a significant increase. Before COVID, we were seeing maybe single digits in telehealth visits for a week. We're now averaging about 50 per day, and our highest day so far has been 87. So that along with many of the payers, including our biggest payer, Medicaid, now paying at par, which means they're giving us the same amount of money for that visit as if somebody was sitting in the health center. So that's been a real positive kind of increase to our reality here. The other piece has been the increase in abortion services that I talked about. That's really been offsetting those non-abortion service revenue drops. Michelle mentioned the PPP loan. Obviously, we were very excited when we applied for that, but you know, that is something that's now in a legal battle and fight. And with any other fight, as you know, with Planned Parenthood, we don't plan to lose. So we are fighting aggressively, and we have many people helping us do that. And we are confident in the end that we applied for that correctly and will eventually get that money. But what is that what is that kind of doing to, again, to mitigate some of these losses? I think we're focusing on recovery of income. You'll see some of that. You've seen some of that during the health center recoveries that I've talked about through donations, through additional grants. The grants team has been applying for things so fast that I can't keep track of how many grants they've been applying for. I know Chris is talking later. I'm sure he's got a number to that, but it's breathtaking. And as Michelle mentioned, the speed at which they're going, you know, we're applying for just about everything we could possibly get our hands on that front. So really appreciative to the grants department. I think, again, we're looking at furloughs and reductions in staff when they strategically make sense. Our goal is to not reduce staff where that would hurt our ability to generate revenue. We still really feel like, even in the midst of this, that we're in a growth mode, and we want to continue to try to expand our services and expand the access to the services we provide, and really to try to prevent any slippage in care. I think one of the things that was, as I thought about, you know, over the last 2.5 months, one of the things that I think was important to note is the staff's appreciation, as Michelle talked about, our ability to move quickly. I had a lot of staff talk to me personally, and just were very appreciative of how quickly we were able to get them to work at home. To literally, you know, we had literally some staff that, you know, in 4 or 5 days went from working in office to fully set up, fully working. Some of our billing staff, call center staff, finance staff, and, you know, their thankfulness that, unlike some of their friends who are losing jobs, they were able to, you know, move their jobs to home and continue to be, feel like they're really making a difference. And so I think that was just something I wanted to share with the group. We just ended 2019. Our audit came in, you know, where did we end the year? We ended just shy of $1 million, about $927,000 gain in net assets, which is about 4%. Primarily driven by unrealized gains and investments in our portfolio. So the market was extremely good last year, and that really helped offset about $300,000 in operating losses, excluding depreciation. So our goal from PPFA is to be at a 2% net margin at the bottom line. So we exceeded that. However, I think internally, Michelle and I have kind of a strategic goal to try to get the 2% at the operating line, and not have to be dependent on some of those investments and the gains that we receive on there, to make sure that we have a long-term sustainable path forward. So a lot going on. As you can see, we have have some really great challenges ahead of us, but, you know, with donors and supporters like you, I'm really 100% confident that we're going to continue to be able to grow, be able to impact our region and local communities, and most importantly, to continue to care no matter what. With that, I'll pass it back to Sean.
Hi, everybody. Thank you, Christian. Next, I'd like to introduce our medical director, Dr. Amy Potter.
Hello, folks. Thanks so much for tuning in with us this evening. You know, I can't start talking without having to acknowledge that, you know, I'm actually sitting in our office at University Avenue, and, you know, we've taken some precautions this weekend and boarded up our windows and done some things. So I just can't start talking without acknowledging that I appreciate you all taking the time to be with us, especially given everything that's happening in our country right now. Though I don't think those issues are unrelated. And I think another thing we've been talking about in recent weeks is, you know, that racism is a healthcare issue. And so that is foremost on our minds, though obviously that can't be talked about without talking about COVID and our response to that, and the health and vitality of our organization long term. So thanks for just letting me have that moment to have that out there. You know, it is amazing when Christian says the past 2.5 months. It both feels like 2.5 months and also like 2 weeks since we've been responding to this. I think the overarching theme in our healthcare services has been rolling with uncertainty. If any of you on the call are in healthcare, you will be able to identify that in this response, it feels like every day is different. And particularly in the first few weeks, it really felt like we were responding to new guidelines and new guidance almost every single day. So I want to reiterate what folks have already said. I'm grateful to our team for, I think, becoming more comfortable with uncertainty and getting really good at becoming creative. And those are kind of the themes that I think have come out of this for me, is that we've become more creative and more nimble as a health services team. And then additionally, I think it's helped us to kind of double back and refocus on our mission, serving our community. I think even the events of this week has brought that more to the forefront of needing to refocus on what we're doing in our community. And in a good way, that has brought it kind of closer to the forefront in our health centers, I think. I don't think anyone in healthcare would deny that there's obvious burnout and challenges in healthcare. And sometimes I think when you get more connected to the roots of why you do your job and what makes your heart tick, it can make some of those challenges a little bit easier. And I've definitely heard that and seen that in our staff. So I will now go through some of the many changes that they have rolled with us. In general, in the past year, we've really been working on implementing change in health services in partnership with our staff. And I think this was a perfect opportunity and really showed how important that was for us. So, specifically, everyone has mentioned telehealth, and I think it's important to understand that really we had an incredible foundation laid for telehealth services that gave us the ability to pivot quickly and be nimble when we needed to when COVID happened. And the foundation was laid for those telehealth services by our grants team working with health services in the past 2 years, maybe even 3 years, Chris. You can correct me if I'm wrong there. But that was a grant that we applied for many years ago. Some of the equipment got to us 24 months ago, and we've been kind of laying that foundation. So it's been really lovely to be able to connect with more of the medical directors in New York State of the other Planned Parenthoods. But I will tell you, they keep telling me how jealous they are because we had this excellent foundation, and then we could kind of turn and say, okay, now we're gonna deliver this care in a slightly different way. So as folks have mentioned, we have been doing this from clinic to clinic. So we previously didn't necessarily have to have one of our NPs or PAs in the clinic to administer services. They could be in another health center. So now we called that our clinic to clinic service. And now what we're talking about is what we call our direct care or direct to patient care. So where we're delivering that telehealth directly to the patient. And as folks mentioned, yes, a lot of times this happens with the patient at home. But what I think it has also shown me is that sometimes patients need to be able to access our services in more ways that respond to their lives. So we've seen a lot of patients sitting in their cars on a lunch break during a shift at work, or sneaking into a private place when they maybe couldn't get out of the house, but they could get to a private place to access services with us. I think also we're going to see a kind of culture shift and understanding about when and where it is to appropriately access these services. There have also been some challenges with that. But I really think what it speaks to is that we're able, this is one of my mantras, and one of our mantras here is be able to meet our patients where they're at. And we've absolutely been able to increase access in that regard. So we now have full telehealth schedules operating every day that we're open in our health centers. And we basically have parallel teams seeing patients. So there are folks seeing patients in our health centers and also folks seeing patients by telehealth. As Christian mentioned, we're seeing, between 40 and 60 telehealth visits per day. And I know we have more, we have ability to see more. Pretty much any telehealth slot that we open up gets filled. So we know as we are able to expand our access on our end, I think those slots will fill. And I'm not sure I saw this coming, but it turns out both patients and staff really enjoy doing telehealth, which I was worried because it is kind of this culture shift of how do you interact with a patient and how do you make that connection. But both from our feedback from our patients, you know, live time when we're talking to them by telehealth, and also in some of the survey data that we receive back, they're incredibly pleased with the care and, you know, just so grateful that they can access care right now. And honestly, when I walk around and check in with folks who are working in telehealth clinics those days, you know, our staff really enjoys it as well. In some ways, they find it super interesting to be able to connect with a patient, you know, in their space instead of in our space, where a lot of times people are super nervous, which I want to make a really, I think, important note to my heart. It has long been a passion of mine in medicine to provide gender affirming hormone care for trans and non-binary folks. And in particular, we've shifted all of our services for that to telehealth. And we have found that community in particular is extremely grateful. That's a community that has historically encountered a lot of poor care or even discriminatory care or abuse or violence in health centers and you know, across our healthcare spectrum. And so for them to be able to access our services in a place that feels safe for them is incredibly powerful. And we've had many of folks that we've been seeing now for years in our program who say, oh my God, can I please only do this? Do I ever have to come back to your clinic and like go in there? So it's really cool. It also, you know, it breaks down regions. We're now seeing patients who are calling in from Buffalo, even though our providers for this care are sitting in Canandaigua or Syracuse. So that's been really special to see. We've maintained access throughout this for all of our urgent services in clinic. We've principally by telehealth been seeing services that were non-urgent or that could be fully addressed by telehealth. So things where, you know, you don't have to necessarily do a physical exam to determine what the best treatment is. But throughout this, we've maintained access for our services that have to happen in the clinic. Abortions, long-acting reversible contraceptives that have to be inserted in clinic, like IUDs and implants, which many of our fellow colleagues in the community were not offering during this time. And I had quite a few of my family medicine and OB colleagues sending us their patients for those services in this time, and maybe even a few of those colleagues themselves coming here. And then we're seeing any, you know, infections or urgent concerns that need to be seen in clinic. And then in accordance with phase 2, as of yesterday, keeping with the times, everything changes every day, we're now offering all of our services in person again in accordance with phase 2 opening in Western New York. So, but I will say, just because we can now see everyone in clinic in our health centers does not mean that we are going to be backing away from our telehealth services. And patients have made it very clear to us that even when COVID is over, they want to be able to connect with us by screen still. You know, the last thing which Michelle mentioned that I just want to point out is that staff safety has been, I would say, our second pillar of importance throughout this, in addition to patient access. We've followed all of the DOH, Department of Health, CDC, and WHO guidelines, even when they change every 24 hours. And we have maintained an adequate supply of PPE throughout this response, which I'm very grateful to our systems that have supported us throughout this. You know, just so you folks know, when patients schedule a visit with us by phone or on the I almost said on the interwebs, online. When they schedule in either capacity, they're screened initially, and then they're for COVID or COVID symptoms. And then when they enter the health center, they're screened again. You know, folks who are being seen for something not urgent, we are able to, you know, redirect them to telehealth or get them seen when their symptoms have resolved. But we've maintained access for patients who are symptomatic or who may have COVID, but are 13 weeks pregnant and have no other options if they need to have an abortion. And that's been very important to us to maintain that access. And I would say not marginalize, yet again, folks who have COVID, who we know are more likely to be in our disproportionately affected communities at baseline, like our Black and Brown communities and those who have less access to health insurance and other supportive services. finally, the last thing I just really want to say is that I am so moved by our staff. I think that Sean may mention this in a moment, but you know, a lot of our staff, as they have heard us have to come up with different ways to you know, fill in these gaps right now, have come to me and said, how can I donate back to Planned Parenthood? And I actually sat here this afternoon and helped one of our PAs fill out her donation form. There you go, Sean, to start donating back part of her paycheck today, because she came into me and said, you know, like, I care so much about the folks in our organization who I know make less money than I do, and I want to make sure that they're safe and that we're taking care of them at this time. And it really moved me. And then, you know, the last thing I wanted to share is, in the past few weeks, I have done quite a few abortions on women who are here from New York City, who were in college here in upstate New York. Syracuse and Buffalo are really where I've had these conversations. And, you know, I didn't really think about folks who were in college from New York City. Like, they didn't go home because New York City was more dangerous. And so I felt like in some ways we were there to not only offer them the service, but also to support them and be part of their support community during this time. So those were really moving, and both were so appreciative for us being open and being able to help them with one uncertainty during, you know, tumult of uncertainty in our world right now. So shoot, I went 1 minute over. Sorry, I'm done.
Thank you, Amy. Next up is Chris Spicer, the VP of Education and Programs.
Good evening, everybody. Chris Spicer, VP of Programs. I'm in my 22nd year now at Planned Parenthood of Central and Western New York. It was Buffalo and Erie County when I started as an educator. I've been through a couple mergers, lots of political ups and downs over the years, but I'll say nothing quite like this. This is definitely a unique situation. But let me tell you, in programs, what I work on, as Christian mentioned earlier, is grants management. So we have been applying for now, we've got 10 grants applications out in the hopper, all of which are amazing. Some of which are for relief, but some of which also are, we're not stopping, we're innovating, we are going to keep moving forward with our work. The most interesting one, I think, is we're trying to tackle the digital divide for telemedicine. So we have this concept where we're going to send educators out with tablets and hotspots and meet people in places so that they can have telemedicine visits somewhere. Maybe even having like a contraceptive information session before the telemedicine visit comes across. So we're really looking at innovation as well. So this organization never stops. We never stop moving forward. We take the hits. We're very, very resilient. I just want you to know that after 22 years, I never think that anything can take us down. So we're fighting. But I want to give you some updates on, you know, what's going on, especially with Restore and education programs. So with Restore sexual assault services, you know, when there's sexual assaults and someone's in the emergency room, they call our counselors and we go to the emergency room, and we're there to counsel, to support, to advocate for that person. And with COVID hitting, the hospitals had to turn off the visits, and that's what we are. We're considered visitors, just like family or others. We're not considered medical staff, so we couldn't go in. But it doesn't mean that this stopped. There were still sexual assaults. There were still people who needed us, so we figured it out. We got phone lines to go into the hospitals so that we could talk to people right on the spot. We were setting up telemedicine-like visits for them afterwards. So we never stopped. In fact, you know, interestingly enough, we became even more busy because some of the moves that we made us that much more accessible. And so more people were reaching out to us for our services. Same thing happened with our legal services. So we're providing civil legal services for people who are experiencing domestic violence and sexual assault. And so the client list continues to grow. And that's a new program. We've built a law practice in less than a year. It's pretty interesting here at Planned Parenthood, based in Warsaw, providing services mainly to rural folks. So, you know, we used to say Planned Parenthood, we're so much more. A lot of people have no idea all the things that we do. We're there where we're needed. So, so Restore is really moving forward. We have all these services going. Well, what about education? Well, let me tell you, we can't go to classrooms. I mean, this is our bread and butter. We are out there with people all the time. We table, we go to classrooms, we go to community centers, we're in schools, and all of that got turned off. And so what did we do? Well, we kind of saw it coming, to be honest. We were watching the news. We've got a lot of people who are masters of public health that work in our education department. And so we kind of had the crystal ball out. And so we started talking actually pretty early about how are we going to switch to virtual education. And so we have a lot of assets, and I'm going to try something in this live event that I'm not sure is going to work, but I'm going to share my screen and show you something real quick. I hope this works. Screen one. So what you should be looking at now is this website. Can we see it? Sean, what do you think? All right. So I'm just showing you, I got these little boxes here. These are actually clickable links. I'm not going to follow them because this would take forever and we would have too much fun exploring this. We would never get back to the other conversation we need to do. So you can see we've got all of these social media channels. Restore has a website. In Control, The Connection. Those are our two after-school programs and their youth drop-in centers. We're on Facebook. And our teen theater has a Facebook page. You should go and check that out. See a lot of their skits that they post. They're super fun. They're super informative. These teen theater students, they are young professional actors and actresses. They are, half of them go to Performing Arts High School in Buffalo. So they're extremely talented. It's a life path for them. And with us, they get to have a job. So it's awesome. So we're on Instagram. In Control's on Instagram. Teen Reality Theater is also on Instagram. Twitter, we're all over the Twitter. We have West Education on Instagram. We have a YouTube channel. We post a lot of videos there and then repost them through our social media. But if you wanted to go straight to the source just to watch videos, well, there's the YouTube channel. And then we got this really cool thing on Instagram going on out of Syracuse called Sarcastic Sex Ed. I really suggest you check that out. It's kind of a unique outreach thing that our educators do. It's really fun and it happens pretty frequently. So I wanted to show you that. But I also want to tell you about our youth drop-in centers. And so what you're looking at now is like the In Control website, and it's going to scroll through the pages and make me look kind of cool. I don't know if you can see that. Can you see that, Sean? It's coming through. All right. Wow. I love this live event. It's working. So we do a lot of youth development stuff. We have a fashion show that's annual. We have cooking classes, step, dance, media, music. And you can see this is a picture right now of them like recording because we have a recording studio. All of this stuff still exists. But with COVID-19 having to close, these kids, they lost a place. They lost this place where they hung out, where they socialized, where all their friends were, where they got food every day, where they just had things to do. So what we did was we got this program called Discord, which is a voice op program where you can set up all these different rooms, and we actually recreated a virtual version of these youth drop-in centers, so that the kids can still log in, go into different rooms, talk to each other, play games, socialize, just to keep that social connection going. It was also requested by, for instance, at the Connection in Niagara Falls, our youth drop-in center there, the director of public health there, Dan Stapleton, actually asked us, is there anything you can do to help us keep the kids inside? because it's really important that they're not out there spreading COVID. So this was actually in cooperation with public health entities as well, just to give them this, this outlet. But something else that they get, like they come in, some of them actually rely on us to get food every day. Lots of families that we serve are struggling with a lot of different challenges. So we started doing safe food drop-offs, right? We have people that actually cook. Some of our educators cook and prepare food. So we've been actually doing that. We've been having games, contests, really fun things that we've been doing online to keep everybody connected and busy. The other thing that I would like to say is that it's not all fun. A lot of people are going through a lot of things right now, and so these youth drop-in centers are our home for them. So they come to us, they ask us for help, and it could be for anything. It could be housing help, connection to services, healthcare services. But we're there to work our magic on their behalf, and so to keep our community healthy and safe. So, and it's interesting, a lot of young people with telemedicine coming out, they find that so much more accessible. They want to sign up for telemedicine visits. So we're finding a lot of interest in that in the in the youth drop-in centers as well. We're actually going to be starting to do a lot more outreach to let people know how accessible telemedicine visits are and how easy it is to make appointments and be seen. And so the educators are going to be helping walk them through that. So we've got a lot going on. I'm going to unshare my screen, and I think I'm back. So that's what's going on with programs, outreach, and education. If you have any questions, please pop them in the chat, and I'd be happy to answer them when the time comes, right? Thank you. Sean's still muted. Sorry, technical details. Can you unmute? There she is.
And also my internet is being very slow, so I apologize ahead of time. We have multiple dance lessons going on in our basement over Zoom. So anyway, here is Deborah McDowell Hernandez, our last speaker of this evening. Deborah.
Good evening, everyone. I hope you can hear me. Can you hear me? Yes? Okay, great. Just wanted to make sure. So I'm Deborah McDowell Hernandez, and I'm the Senior Director of Public and Community Affairs. I have a team of a team of three. The brand marketing manager, Caitlin, is based in Rochester. Sarah Connors is our community affairs assistant. She's based in Rochester. And Leslie Feinberg is a public affairs organizer, and she's based in Buffalo at the Main Street office. So like many others, like my colleague Chris, my team has had to change their pace and the way we deliver information on advocacy and partner with community partners given the pandemic. So prior to the pandemic, we were out and about in community, partnering with different people, doing programs at churches, tabling at different community sites like colleges and other health fairs and things like that. So suddenly we had to change our pace and become very acquainted with the virtual platform and digital way of engaging our supporters and activists. So we have been doing that since, I believe, March was our first virtual programs. We did about 2 or 3 programs in the month of March, but unfortunately, some of the things that we were engaged in have become a little more tricky to continue to pull people into. U.S. Census engagement was one thing that we hoped to really, connect with people face to face on, as well as voter registration. We distributed information to all of our health centers, which is good. They all still have that information. on U.S. Census. However, we obviously aren't tabling in health centers distributing U.S. Census information, nor are we tabling at health centers distributing voter registration information given the public health crisis. So we've been doing our virtual or Take Action nights, which at one time were in person, face-to-face, at our office or at the site of a community partner's office. We've been doing those virtually using Zoom, and they've been well attended. And we did one in March for the U.S. Census. In April, we had one to bring awareness to Sexual Assault Awareness Month. So we've been elevating the word about programs that are offered by Planned Parenthood, like Chris's team, Restore, does sexual assault and domestic violence support. So we are continuing to engage people at that level. And actually what we're finding is that we're getting a lot more clicks and opens since we've gone into the pandemic mode of doing programming. And Caitlin Doty, who is our brand manager, is tracking this really well. And I guess, I hope it's because people think we're so interesting, or it could also be because they are at home more, but we are getting, we've seen a great rise in the rate of emails being opened through every action and just the level of engagement. So people seem to be comfortable connecting with us on Zoom and going that route. This has also given us an opportunity to be a little more collaborative. I've had an opportunity to work more with the members of the programs team. And one of the collaborations, public affairs and programs, has started, and we started it in March, is called Sex, Love, and Healing. So it's a series that was designed to address issues that may have been impacted with the COVID-19 crisis. So we wanted to be able to engage with people in a way that would look at issues like healthy relationships, sexual assault, family planning, things like that, that we thought may have been vulnerable or impacted greatly given social distancing and sheltering in place and things like that. So that has worked out really well. We've done a lot of creative programming. We had one last week called Being an Askable Adult is More Than a One-Time Conversation. So I worked on that with two of the educators, one in Syracuse and one in Buffalo. They took on the information and coaching folks on how to be an askable adult and being comfortable talking about sexuality with teens. And then I took on the part of talking about the comprehensive sex education bill. So we've been able to do these programs and offer the education piece as well as the advocacy piece based on a piece of legislation that might be related to something that we're promoting through programs and outreach or in the health center. So that's worked out really well. As you all know, this month is Pride Month. And unfortunately, because of our public health crisis, many of the special events and festivals and parades that would have taken place normally are not taking place. So again, Public Affairs has teamed up with programs, and we've come up with a menu of virtual programs that we're offering in the month of June to celebrate LGBTQ plus Pride. We have one project or piece called Letters of Pride, where our supporters, staff, really anyone can write a note, upload it, take a photo, and we'll have it on display on our website. Michelle Casey did some nice welcome remarks, and we'll be featuring the creativity of youth and the programs that Chris introduced you to in the slides earlier. So it's given us an opportunity to allow adult staff as well as our team staff to show off some creativity. And obviously with the recent events in our community, the country. We are trying now to elevate racial justice more and inform the public of that. And we've added some great resources on our website. So if you're on the website and you go on the landing page, you can click on a Learn More option, and it'll give you a listing of resources that you can check out, reading materials on how to be an anti-racist, information on what you can do to support the cause, supporting Black voter registration, the color of change, and all of these other things. So we want our staff and our activists, our donors, our supporters, the general public to be well informed on this and be able to educate others. So check that out on the website. And we are planning to we were hoping to do it this month, but given all of the things that are happening, we'll probably put this off until July. But Public Affairs wants to have a virtual retreat and get a little more training on ways that we might be able to continue to engage folks, because we realize that summer is coming, and I don't know that we'll be able to get people to be as hooked to their laptops and devices when it's 80 degrees out. So we want to call in some experts to give us some tips on ways to continue to raise awareness on Planned Parenthood's programs and our services, but also keep people wanting to come back and learn more until we're able to do programs the old-fashioned way, in person, live. And we also realize we need to be creative with voter registration, given some of the limitations we have. So we want to work with some of our friends at PPFA to get a little more insight and guidance on ways to continue to engage people. So I think that's about all I have. If you have questions, I guess you could put them in the chat box.
Thank you so much, Deborah. I think we're going to end up closing out the presentation this evening. We have run out of time, but I will keep track of everyone's questions, and I will do a follow-up conversation with each one of the participants this evening. And if you have any further questions that you didn't get to ask tonight, feel free to email us at giving@ppcwny.org.